Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical show on News Talk 760 WJR. We're going to be talking about prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre-screening and simple non-invasive tests can actually prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to News Talk 760 WJR.
Sounds like Facebook.
Facebook, are we on Facebook Live?
Yep, so we
Yeah.
are on Facebook Live. I still have some ads in my ear, so I'm talking over that a little bit, but there we go.
Anyway, one of our friends in Korea is going to be calling in. Hopefully she gets the connection because it's 18 hours different.
Well, we're here.
And,
She's,
typical prototype patient out there who exercises, skinny, runs, walks her dogs, turns somersaults, eats good food, and then gets outstanding numbers like over the chart. And she's like, what do I do now?
Well, we'll hopefully get her call and we can make suggestions.
Mm-hmm.
Hopefully this show we can talk a little bit more about prevention, maybe less about COVID, because I think there's less to talk about COVID now.
Right.
Mainly conspiracy type things, but
Don't
they might
forget
be
about
true.
that.
All right. Well, I do like talking about it, though.
No, I will then talk about it after we get off the show. We can talk about all the conspiracies
We can talk
in America.
about it on Facebook.
Yeah.
The conspiracy stuff. But
we already have a caller, by the way, so we
wow.
can maybe start with that. Yeah,
That's probably is it Kayla?
No, it says James and Warren. So
wow.
Somebody probably that's been waiting to call since last week or something.
That's our record. That's our early.
There we go.
Call.
I know. First segment caller. That's pretty exciting.
You're gonna take the show over right away.
Yeah, you might not be talking one day.
And he might ask a question that requires a conspiracy answer.
Oh, then forget cutting him off. Let's see, when are we back anyway?
Right now? Break. It says 7:09, and it's only it's never mind. I'm looking at the wrong clock. I'm looking at 07. I'm looking at 7. I'm like, that's a long time to go.
Welcome back, all of you listeners, to our live weekly medical radio show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are back again tonight to talk to you about prevention and why you have to start looking at healthcare in this country from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, welcome back. It's always a pleasure to have you on the air live talking to patients. They all need help out there, and this is the first time we've had callers lined up before we go on the air almost. But we're going to try to stick to prevention today. I know we always talk about COVID. But Siobhan, welcome from Miami, Florida. Who do you have on the line?
Thank you. So up first, we have James and Warren on the line. James, what's your question?
Oh, hello. So I had last week a nuclear stress test, echocardiogram, and about 6 months ago, cardiac catheterization, which I was told is the gold standard. Everything came out good. I'm 68, and I still have a little chest discomfort. What do you think would cause that? Do you have any ideas?
Well, thanks for calling, James, first. And, unfortunately, none of those tests really diagnose you for your risk for heart disease, because those tests are looking at the blood flow, which is what's between the walls of your artery. I need to know what's inside the walls of your artery to identify your risk. You should still get a CT calcium score unless that's included in one of your tests. And then we do a test in our office called a carotid intima media thickness test. So those are the best tests to identify your risk for disease. I've had patients who were told that they're fine after the test that you had, and they still have plaque, and I'm working hard with them to shrink the plaque that they have. It was missed by a heart catheterization. So it's unfortunately, it is no longer the gold standard for prevention in my book. As far as your question, after you've made sure you don't have heart disease, which you have not done yet, I think, a common cause of non-cardiac chest pain is acid reflux or musculoskeletal injury. Those are things to look at. But again, from a prevention point of view, you haven't really done the due diligence yet. Not your fault, though. You're doing what the doctor says, which was the wrong thing.
Well, James, thanks for calling. We've got to get on with other callers, but I mean, and in defense of the poor patient that's calling in, his doctor needs to be the shepherd and tell him what test to get, and he needs to get the CIMT for sure. So, James, you can certainly call Dr. Kolender directly, and we'll be talking about his number
Let's
as
come
we
back
go.
to this after the next call.
Yeah,
if
we got
have a
another
chance,
call.
because there's more to talk about here
Yeah.
about James.
Okay, who else
Okay.
is on the line?
Yeah, so up next we have Tony and Wayne. Tony, what's your question?
Yes, I did not get the COVID vaccine. Is it safe to get a blood transfusion from one that did have the COVID vaccine?
Interesting
I
question.
mean, well, it is an interesting question. Can I ask you, why is this pertinent?
Why is it important?
Well,
If
no,
I
I
need a
mean,
blood transfusion.
oh, and
I
you
don't
want
wanna
to,
get one.
Yeah.
got it,
Army.
got it. If the person got the vaccine more than 5 or 6 months ago, it's probably a lot less active in their body and should be okay, but I can't say for sure.
Okay,
But as
thank
you know,
you.
you're welcome. Thanks for calling.
Okay, do we have anyone else on the line, or we can come
No,
back
not
to?
at the moment. Yeah, we can go back to
Okay,
what we
Dr.
were talking
Collender,
about.
let's pick
right.
up on where we
Yeah,
left
I'm going to
off.
go back to James, because here's a guy with what I would call atypical chest pain. Chest pain that's not sounding like it's cardiac per se. He goes and gets a stress test, which is normal. Why go and do a heart catheterization after that, which has a risk of negative outcomes? It's a low risk, less than 1%, but still there's a risk of getting a heart catheterization after a normal stress test with atypical chest pain. So that's the problem with our system. It's even a normal test isn't considered normal, even though it was the wrong test to do. Well, he had symptoms, so getting a stress test isn't the worst thing, but why put him through a heart catheterization? I don't understand it. It's excessive.
So who would have written the prescription for that? I
Well,
mean,
that's a cardiologist decision, because that's who does the test. And so,
let me stop you here. Are cardiologists like over indulging in prescribing tests that are unnecessary or that are dangerous? Or, I mean, that's you yourself said that was totally not called for.
well, it's well known that a lot of cardiologists utilize a heart catheterization as the first line investigative tool in someone who presents with chest pain symptoms. And we talked about this on the upcoming Sunday show
at 3:00. Yeah.
how medical management is as good as an intervention in people with stable angina. We've talked about this on the show many times. So if your initial test is okay, and you're not dying right then and there, medical management is a much better option than a procedure that has its own risks. So if it's all the same, why go through the procedure? It doesn't make a difference scientifically.
Quick question: who is the doctor that's shepherding medical management? Is that the PCP or the cardiologist?
Well, in these studies, it's the study group. So there's a whole process involved to make sure that the participants are getting the medical management that the study required. But in real life, there's nobody to shepherd people through a medical management process.
So they can't even get into the process. Let's come back and talk about that on the other side of the break. Again, you are listening to our weekly live medical radio show where we keep you up to date on all medical solutions from dealing with COVID to avoiding catastrophic disease. We are here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and would like to talk to the doctor directly about what you need to do to prevent or reverse disease, Please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Boy, that call we never had, which is, do we get a transfusion from, how do we stop getting a transfusion from a vaccine recipient?
You get a transfusion, you don't know where the blood's coming from or how long it's been there. I mean, they don't have labels on it about where the blood came from.
Maybe it should.
Was
Well, what would be the effect if someone that hadn't gotten the vaccine got a blood transfusion from someone that did have it?
Wow.
Well, first of all, you don't want that stuff in your body. They're asking the question they don't want in their body. And keep in mind that the vaccine is triggering your immune cells to make spike protein. So you're making the inflammatory product that the virus makes. And this is why there are vaccine-induced injury. The only difference between the vaccine and the virus is the virus replicates and keeps making more spike protein, whereas the vaccine doesn't. So once all of those, once that quiets down, that process, it goes away, and then so does your immunity, because your body doesn't have memory. And in fact, we should talk about this on air. Our buddy, Marty, your buddy too, Marty McCary, was on the news.
When was he on?
He was on yesterday. And
what was he talking about?
He did a study at, wherever it is he works that
Johns
showed
Hopkins.
we don't have to promote everybody else, but
But we're not on the air.
Well, we're on Facebook with our 1 million listeners.
Okay.
Our 1 million of followers.
Okay.
Right? So his study showed that there's natural immunity is still going on 2 years later.
Mm-hmm.
So vaccination immunity is gone in 5 months, and if you got the Johnson vaccine, it's gone in 2 months. They're telling you to get a booster 2 months after your Johnson vaccine. What a joke. Anyway, natural immunity is still happening, and it's just being ignored.
Mm-hmm.
So,
Well, it's an interesting question because, when people go to donate blood, I don't think anybody's asking them any questions. You have a caller?
We had another call come through, by the way. Yeah.
Okay, so we'll go back to that when we get on. When are we?
30 seconds.
30 seconds, okay. And we're
so it's, and I know we're on Facebook, but if anyone thinks it's important to talk about that, on Fox News, they mentioned that Fauci might have known about the lab leak 2 days after the lab leak. I'm open to talk about that.
Oh my God. Fauci
Just throwing it out there.
Right.
It's all Fauci slamming. If you're just now joining us, I'd like to let you know that we are welcoming you to our special weekly medical radio show on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Siobhan, do you have another caller waiting to get on the line?
Yeah, so we have two on the line, but let's start with our Canadian friend. We have Dave in Windsor, Ontario. Dave, what's your question?
Yes, good evening, guests. One of the things about that I wonder if you know too much about digestive issues that can they also be contributed to heart problems? For instance, if you have like acid reflux and you're not properly digesting your food and you're not properly absorbing it, giving it a chance to get absorbed into your body, are they major contributing factors to heart disease and stroke and what have you? What do you know about that?
Well, thanks for calling, Dave. Great question. So the term that I use for that is called gut dysbiosis, and some people might refer to that as leaky gut. And the idea is that when our gut lining is exposed to a toxic environment. And frankly, we live in a toxic environment. Our GI tract is open to the air, if you think about it. And so all the foods, chemicals, pesticides, metals in the soil, everything that we eat that is a chemical that we're not raised, or, if you want to say, we haven't been developed to digest those things, those damage the lining of our artery and generates an autoimmune response. So gut dysbiosis is a major problem. And so when I hear about people having acid reflux or colitis or any kind of bowel disease or GI upset, I put it in those terms. And these are, I think it's a very effective way to get people to change their lifestyle. And we make the recommendations appropriate to the person and what they're dealing with at the time.
Okay, Dave, thanks for calling. Siobhan, you have another caller?
Yeah, we have two more again now. So let's start with Bob in Shelby Township. Bob, what's your question?
Question is for a family of a history of cholesterol, heart problems. And now the family's grown up and getting older, and they're on statins. And now we're finding out the lipoprotein A is getting extremely high for one of the individuals. I know there's a medication for it, extremely expensive, and some studies coming up. But I also know that statins also raise your lipoprotein A. In your protocol, is there anything that you address specifically to get lipoprotein A under control?
Well, thanks for calling. Great question. So first of all, like we always say, especially in somebody with elevated LPA, it's important to identify your plaque risk. So more than ever, you need to get a CIMT ultrasound, measure your artery walls, get labs that measure artery inflammation that help identify your risk of having an event. That's critical. So that's number one. Number two, people with LPA, you can take niacin. So extended release niacin helps mitigate the risk of LPA. And you want to take as much of it as you can. Don't take, non-flush or slow release. Niacin is going to cause a hot flash and turn your skin red for an hour. That's just how it is. You got to take it anyway. Now, if there's a family history of high lipids, you may have familial hyperlipidemia, which is a genetic phenotype. So there's not a specific gene that causes FH, but it's a collection of a few thousand different genes that produce elevated lipids in a family situation. So there's a formula to follow that you can identify each of the individuals in your family. Do they or do they not have familial hyperlipidemia? And if they do, then they're a candidate for Repatha, which is my favorite PCSK9 inhibitor. So Repatha is indicated for familial hyperlipidemia, and it also, as you already just said, lowers LPA. So you can get two birds with one stone, and it would be covered by insurance because it's approved for FH. So you need to go and ask your doctor, you can probably go online, gather everybody's pre-treatment LDLs and calculate your probability of if you fit the criteria for FH.
Well, that certainly was very
Okay.
helpful to caller Bob. And Bob, don't hesitate to call Dr. Kolender directly if you need more information. 866 Kolender. Siobhan, you have another caller?
Yeah, so we have two again now, starting with Mark and Howell. Mark, what's your question?
Yeah, I'd like to have the doctor comment on really when it comes to prevention, most doctors these days are omitting vitamin D level tests for people. As a type 2 diabetic, I've worked on this for 3 years, well before COVID. And I've lost all my weight. I'm getting, my A1C is down. I've done a lot of things positive, and I've known that diabetics especially, and a lot of people have historic or typically low immune systems. So I've worked on that. My D level tests between 70 and 90 for 3 years now. And
that's good.
I talk to a lot of people, and their doctors are clueless about, even testing for vitamin D, or even therefore, and also how to advise a level. I have a person that I work with, it's a type 1 diabetic who's generally healthy, but her level tested at 25, and her doctor told her, "You're doing great. That's just fine." And that's way low.
Well, I'll agree with you 100%. Thanks for bringing this to our attention. But there's a few, so agree with you everything you said. So vitamin D, as we learned with COVID, helps boost our immune system. And to no surprise, if you're not on blood thinners, you could probably also take vitamin D3 with vitamin K2. So D3, K2, because D3 is better absorbed when you take K2 with it. And also vitamin D3 helps lower insulin resistance, which is the driving factor in becoming diabetic. You could also take curcumin, which is a supplement. It's the active ingredient for turmeric. Curcumin and vitamin D3 together and separately have been shown to improve people, improve their insulin resistance. Another thing you can take, and again with all of this, is a teaspoon of Ceylon cinnamon. Ceylon cinnamon is Ceylon, which you can find online. So a teaspoon a day of Ceylon cinnamon with the D3K2, with the curcumin, also helps reduce insulin resistance. And then the only other thing that you got to think about is hormone balancing. I think all men with insulin resistance and obviously diabetes are low in testosterone. And so that's an opportunity to optimize your hormone levels and further improve your health. And of course, get a CIMT, get a CT calcium score, see what's going on with your arteries. In my world, hemoglobin A1C is not an endpoint I care about. I've got plenty of patients who heal their arteries and their A1Cs don't come down. And I've got patients with good A1Cs and bad insulin resistance, and their arteries are not happy. So get your arteries checked and don't worry about your A1C.
Mark, thank you for calling. Well, Dr. Kolender, that was a loaded answer.
Well,
Like
there's
a
a-
year's worth of information. And even Siobhan's going, what's going on here? I know we've got another caller. We have other callers coming in, but we're going to have to catch them all on the other side of the break. But I'm hoping that our last caller got a world of information from you. In the meantime, we're going to take a quick break. Again, you are listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or if you have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Well, let's talk about Wuhan lab.
No, let's not. Why did she give you my laptop? He's got his
Well,
own laptop.
I mean, just a letter from January 11th. Who's this from?
To whom? Who did it go to?
It's going to Xavier Becerra, who's a senator, chair, apparently secretary in the Department of Health and Human Services, talking about the details of who knew what when.
Who cares what when? Who cares, okay?
Well, this is why, AnnMarie. This is why it's important.
It's not
Okay.
important. America it needs to take responsibility for what they farm out to China. End of story.
The average citizen does not know what the government is doing on their behalf. And so knowledge is important and transparency is important. So if you'll remember in the beginning of the whole COVID, when I mean the beginning, the first year and a half, we had callers calling and expressing their concern about the vaccine, about where this thing came from. And all I said is, look, I'm a fan of vaccines. They reduce inflammation caused by the virus that triggers the inflammation. And, I can't speak of all this stuff because there's no transparency on the details of the studies and all this. But I got to believe that the government's not trying to kill us. That's what I would say all the time. And then as soon as they mandated the vaccine after continuing the emergency use authorization for the Pfizer vaccine, yet approving a version of it that still no human has ever received. You can't have emergency use and an approved drug, but they're doing both to allow this to continue. That's when I said this is very fishy and they're trying to do something bad. I mean, this is deceptive. So when the government and taxpayer money is being used to fund research out of the country because it's illegal to operate that kind of research in our country,
Why is it illegal?
because Congress made it illegal,
Okay, but give me a more sensible answer than that.
because it's dangerous.
What's dangerous?
Gain of function research on viruses is dangerous, which apparently it is, because it's caused COVID and this pandemic.
So it's not dangerous to send it to Wuhan and China and let them handle it.
It
and-
is, but allowed China to do it. So the NIH funded this research in another country that was willing to do it. And there's no way that the head of the NIH, which is essentially Dr. Fauci, does not know every single thing that's going on under his purview. The guy's very smart. He's got an answer for everything. Don't tell me he doesn't know what's going on. So now so then there's a outbreak, and he's telling everybody that it comes from a wet market. When now there's a potentially documents saying that he knew about it 2 days later and told us not to wear masks. She's not amused.
Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about two important topics: prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7 p.m. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that number is 800-859-0957. Siobhan in Miami, how many callers do you have?
Yeah, so we have two on the line right now. Let's start first with Kayla in South Korea. Kayla, what's your question?
Kayla, welcome. We're glad to hear from you. You're always coming in on Facebook, but here's the doctor waiting for your call.
Thank you. Dr. Kolender, I'm from a family history of heart disease. I'm not overweight. I eat fairly well. I exercise more than most. I walk a dog 3 times a day. I'm starting to do kettlebell exercises. I do intermittent fasting. I'm on a fish oil supplement. And the other day I had a blood test and my HDL is 461 and my LDL is 360. My doctor put me on Lipitor, 10 milligrams, and told me to eat better and exercise.
Oh my God, don't you love it? Eat better and exercise. Just love it. Okay.
Well,
So,
Kayla,
I mean,
go ahead.
Go ahead. No. So I'm like, I don't know. I know I have genetic issues, so that's probably the biggest factor, but I want to know what you might suggest.
Right. So your LDL was 360.
Yes.
So just like the last caller, you have familial hyperlipidemia, and you should not be on a statin, or maybe just a low dose of a statin, and you should be put on Repatha. That's number one. Forget us. You need to be on both. And the second thing is you really need to get a CT calcium score to see if you have plaque, and then get a CIMT, or get the CIMT first and see if you have plaque. And then that gives you some data you can follow moving forward on your progress. What were your triglycerides?
So the Lipitor kicks in. Should I wait my 2 months? He's going to do another blood test and then do the CIMT.
The cholesterol levels are meaningless. They mean nothing. The only meaning to your cholesterol is that you have a very high number, which puts you in the category of the familial hyperlipidemia, which means you're a candidate for Repatha. And so you might take a baby dose of a statin, like 5 milligrams of, I like rosuvastatin, which is generic Crestor, over Lipitor. And then you should be on Repatha. And then who cares about your cholesterol? It's about, do you have plaque? There's nothing about that number that's going to change anything.
Did we lose her?
Yeah, so you just get your disease identified, and then go from there. What's your triglycerides?
Oh, I'm so sorry because everything's in Korean, so I only had those translated.
Okay, well, yeah, you got to identify the disease first, and get on Repatha and a low dose of the statin, and then go from there. And get an LPA, just like the other caller. Get an LPA level to be sure.
Okay, Kala.
Thank you.
Keep following us on Facebook, and hi to everyone in Korea. Thanks for listening. Siobhan, who do you have?
Okay, we have a few calls that came in. Up next, we have a Brian from the West Side. Brian, what's your question?
Hi. You may have or answered it in part. I'm 61 years old. I have a very sedentary lifestyle. I'm probably 20 pounds overweight. I take 5 milligrams rosuvastatin. That's my only medication. I don't have any other information like what my triglycerides are and stuff. What I'm interested in finding out is what should I ask my doctor? What kind of test should I have to find out if I have plaque, or if by the way, I have a lot of cardiac issues in my family, but I have had none so far.
I hate to say it, but you're just not going to get to the bottom of it in a standard medical practice that puts you on a statin without, knowing anything. So, you need to get a CIMT to identify your risk. I hate to say your doctor's not going to know what to do with it. Get a CT calcium score if you can't get that as a way to identify plaque. He's treating you as if you have plaque without knowing whether you do, because just because you probably have a lot of risk factors doesn't mean you have plaque. So you got to start with there and then back down. I just don't know what your doctor's going to be able to identify. If your triglyceride to HDL ratio is high, meaning, then you may have insulin resistance, you've really got to not eat sugar and exercise more, but also it all depends on what your arteries look like and how intensive the therapy needs to be based on that. So to throw out, do this or that is a little out of place.
So what's he to do? I mean, he's got to be his own advocate, right?
He's got to keep listening to the show or call us and educate his doctor.
That's, that's like laughable. You've got to educate the doctor. It should be the other way around. The doctor's there to educate us. Do we have any other callers, by the way?
Yeah,
Siobhan?
we do. Up next, we have Dan in Flint. Dan, what's your question?
Yeah, I have a family history of heart disease and stuff, and I'm around 60, height and weight proportionate, and high blood pressure. But my doctor had me take one of those scans of your heart where they can look at everything all, I don't know I can't remember the name of it.
So what was your score?
They see it in 3D. Pardon me?
Did you have a calcium score?
I did not.
So what did the test show?
I asked him about a stress test, and he said, you know what, you'll pass the stress test. But if you really want to know what your heart looks like, I'd get one of those scans. That's what, so I did. And the lower, the LAD, I think that's what it's called, goes, that had maybe a 40-some% blockage in it.
So you have
I was
plaque.
wondering what you would do as far as treating it.
Well, again, it's not just so you have plaque, you should be on a statin, and now you need to go on a hunt for all of your other drivers of disease. Do you have insulin resistance and treat it? Do you have sleep apnea or other sleep disorders? Do you have gut dysbiosis like Dave mentioned? Do you have oral health issues? Do you have bacteria in your mouth that contributes to disease? Do you have other genetic markers that need attention? So these are all areas that need to be addressed. And unfortunately, most traditional doctors do not even know where to begin. They're just going to put you on a statin and call it a day, which is not enough. It just isn't enough. Thanks for calling.
All right, Dan, thanks for calling. Yeah, I mean, I'm just amazed at the number of callers that call in, and it's all the same. It's like they don't seem to be getting guidance or shepherding from their primary care physician or their cardiologist. So it's
I mean, what we're hearing today is like your basic, I went to my doctor and I found this and here I got
and
put
now
on a
we don't know what to
statin.
do with it, right?
Well, but these are the people, half of them are going to have a heart attack because all of their different conditions weren't identified. And according to the doctor, the statin's all you need to do. And it just isn't.
It's really a sad
No,
situation.
today is sad.
It's really
This is
sad to
kinda
think. Unbelievable. Like all these people are in the doctor's care, and the doctors aren't caring for them properly. Siobhan,
Right.
you have another caller?
Yeah, we do. Do we have time to take another caller?
Sure, go
Yeah,
fast.
then we'll come
Okay,
back.
all right. So let's jump to Tim in Brighton. Tim, what's your question?
You have 30 seconds, Tim.
Chronic non-productive cough, 10 to 15 years. Been to a pulmonologist, been to the allergist, had chest CTs, everything's clear. Been to the acupuncturist, a naturopath. Chronic cough will not go away. The only environmental component is on cold days like we've had the past week or two, the cough will increase. So I'm at wit's end. I don't know what other things are available. And after the break, I might be able to give you a little bit more detail
All right,
about everything I tried.
All right.
hang on. We can try
Yeah,
to
hang
go
on.
into this.
We'll come
and
back to you after the break.
Listen to Facebook. We're talking about COVID.
Right, exactly. In the meantime, you're listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subject we're discussing and you'd like to hear from the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You are listening to News Talk 760 WJR.
Okay, so we're back on Facebook Live, and I'm heading to a concert. So this is Olivia's chance to take over.
Good luck.
Thank you.
What's
Have a
the
good
story?
show.
Are you actually going to do this concert tonight? They confirmed that when you get there, you're going to be on.
Yeah, they postponed it to an hour later, so I ended up running home to catch the show. So
All right. Well, thanks, Siobhan. Always nice to
all
have you
right,
on the show.
great show. Don't forget you have your caller still on the line when you get
Yeah,
back.
when we
Okay.
come back, and Olivia's
Okay.
taken over and happy to do so, right, Olivia?
Okay.
All right. Have a
Okay.
good show.
Thank you.
Bye. All right. So, what do you think is going on with the guy that just called?
Well, let's talk about the other guy in the government.
What other guy in the government? Are you gonna forget about the government? The government's deadbeat. They're not getting anywhere. I mean,
but it's people need to know how they're being abused and their tax-paying money is being used, and to say, well, you can't help the government. Well, in America, we can elect people, and you at least have a chance to vote, and if the highest position doctor in our country ignored a symptom, ignored a public health emergency in the early days of it, especially when he funded the lab, that's a major
he didn't
problem.
fund the lab. The NIH funded it.
He's telling them where to send the money.
Okay.
That's his job. He's in charge
No, his
of all
job
of it.
is to wake up and smell the coffee and realize America's not going to have it done here because they're too cheap. Let me spell that for you. CHEAP. They're too cheap. They love sending things overseas to China. Don't complain if China screws it up. You bought it. You got it from there. You've been getting stuff from China for years because you're too cheap to pay for the research here. Researchers are underpaid. People get PhDs in bacteriology. They're making pigeon feed.
There's
So
a high, I
Fauci-
know, but there's again, I just like, we can talk about this on Facebook because we're not going to talk about it on the air, but it's high level, corruption that and incompetence. I mean, if you came to me and said, I'm bleeding from my rectum and I didn't send you to a colorectal surgeon, and that's basically what happened.
Mhm.
He knows what's going on, and it's been leaked
Mm-hmm.
and told everyone it was from somewhere else and told everyone don't worry about masks, didn't advise the president to shut down international travel. He knew what was cooking in that place. Bad stuff. And maybe there's worse things in there that might have gotten out. This is what we're talking about, that our healthcare system is broken. And this is a huge example of it, that there's people being paid by pharma companies to generate research, and they're gonna choose that over their real job, which is to protect Americans. All right, we'll talk about
So what do you think the answer is? We're back on the air now. Is this the final
well, the
segment?
answer is the book.
Is this the final? You want to talk about your book?
No, you asked
this
me
the
the
final
answer.
segment?
This is the final segment. It's almost 8 o'clock.
So we're welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, just before the break, we talked to Tim in Brighton, who has a chronic cough. I don't know if he's still on the line, but
Oh,
okay,
great.
go ahead.
So, Tim, let's make some assumptions. Let's assume you don't have lung cancer, you don't have some chronic pulmonary fibrosis, you don't have some chronic infection that's been missed. So let's assume this is not a primary lung problem. So, other causes of chronic cough are mild asthma, which is a lung problem. So, I would put you on something like Singulair, generic Singulair, which is great for mild cough variant asthma. I would do that first. I would look at this as being a symptom of acid reflux. And again, talking about Dave, this is could be a presentation of it just could be acid reflux, and I would put you on a very, restrictive diet to heal your gut in case that's what it was.
Yep.
Can
Can I interject real quick?
Sure.
Yeah.
I'm pulmonologist. No chest issues. There's no asthma. There's no sports-induced asthma. I've done the Singulair, tried the various inhalers, steroidal and non. We've tried the reflux medications, done, for GERD or silent GERD. That's nothing there. We got to the point where we thought it might have been a neuropathic cough. So I've tried the gabapentin, amitriptyline, no help. And, like I said before the break, went to the ENT, didn't see any scarring that was indicative of any significant nasal drainage. I have been to a naturopath, changed up the diet, tried to get everything changed up. That was unsuccessful. Finally, the acupuncturist felt pretty good after a couple months, but then the cough is back. And when you were talking to one of the other callers and you mentioned some of these other vitamin options, the D3, K1 or whatever it was you talked about, I thought maybe there should be something else along those lines that I could try.
Well, I would look at that as a gut health heal, and some combination of the right kind of diet and a functional medicine doctor that works on gut dysbiosis. That's what I would work on. And just because your first go round didn't work, I would still work on that route. You just may not have found the right food triggers, and you may not have found the right kind of supplements to heal it. So I would still work in that area.
Okay.
Good luck.
All right. Thanks for calling, Tim. it's amazing that there are patients out there that are bouncing around from doctor to doctor to doctor. It's a challenge to get to the right doctor and to get healed. Never mind about prevention.
Well, we didn't heal him yet, but you hear this journey. I mean, that sounds like a
Right.
2-year journey. And because each of these drugs, you got to give it a couple months.
Hmm.
And, some bizarre drugs to treat a chronic cough. I mean, he did go through a good run of different things. But just because he went to a naturopath and was put on certain foods and supplements doesn't mean it was the right foods and the right supplements for him. So we really have to look at, gut health. And this is possibly one of the impacts of it, which we don't think about.
So does all of this lead back on the path to prevention? Is this where, the patients that have called in tonight, what are they all missing? I mean, they're all in bad shape.
Well, what's interesting is that everyone who called either did not have a diagnosis. They didn't
Right.
identify their plaque, or they did identify the plaque and they were still left with no recourse other than maybe take a statin. And for Kayla's doctor to not recognize familial hyperlipidemia with an LDL of over 300 is kind of scary, frankly,
Hmm.
just scary.
Hmm.
And, and just, you just don't even care about being on a statin. I mean, you need to be on one because Repatha works better with a statin than without one, but the statin's not doing the job. It's a genetic problem. So if you have it doesn't matter who you are, because there's data that shows that people without any risk factors or any family history still get plaque and have events.
Right.
So you've got to diagnose your disease, which is, do you have plaque? And then you want to have data that you can follow. The CIMT is not the data. That's the disease. That's the identification. Then you have to find, because repeating a CIMT doesn't help you. Not the CIMT. Repeating a CT calcium score doesn't help you. You need the CIMT, which gives you repeatable data that changes with the changes of your risk.
Hmm.
That's what's really you got to do. And then someone's got to guide you through it.
Well, coming back to Kayla's case, I mean, she's obviously an American who grew up here in Michigan and is a teacher in Korea right now under the care of a Korean doctor. But as much as I know about her family history, her father had cardiac disease at age 30 and he died at age 40 something. So obviously there's some kind of genetic factor going on there.
Well, and I don't understand. I don't know anything else about Kayla than what we just talked about today. But when you have that kind of family history, you've got to go and get fully checked out. And she might have in her mind, I went to my doctor, they said I'm fine. But
Mhm.
if she's just learning at whatever age she is now that she's got a high LDL, that's too late. I mean, it's not too late, but it's that you need to know a long time ago. And then work on all the other drivers of disease because you just don't know what else is impacting your health.
Well, I mean, at this point, though, like you've said, you've had many patients a lot older than her that have come into your practice and you've gotten them under control. So I'm assuming that
No
she
one's
can
too
get this under
late. She's
control.
right. If she's alive, then it's not too late, and you can wrap all this up and follow the markers and confirm that you're going to go the right direction. So it's never too late, but just why are we just learning about that now? And so you cannot assume you're okay just because you're thin, you exercise,
Eat
you
healthy.
intermittent fast. You can't make those assumptions. And, bad things happen because you don't know what your risks are.
So should she be starting off with the CIMT?
Absolutely.
So I'm wondering what the availability of the CIMT in Seoul, South Korea is.
No idea.
Yeah, good question. She'll have to look into that, and then if not, she's gonna have to fly back here and get it done in your office.
Sure.
So we have 40 seconds, Dr. Kolender. What do you want the listeners to know?
Well, we had great callers.
We
We
did.
really did. Everyone's on point. As soon as we say we're talking about prevention, we get all these great prevention related calls. So, bottom line is identify the plaque, get markers that identify risk and that can be followed over time, get the labs, and find someone who can guide you through this process because it just isn't going to happen in your standard doctor's office, unfortunately. And you've got to be your own advocate because you're not going to hear about it in a 3-minute office visit.
Absolutely. And everybody basically needs to get the CIMT. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks also to my co-host, Siobhan Cronin in Miami. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening live at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.
Opinion.